Hi guys, good day everyone, and this is Kimberman from Kimberman Studio, and in this video we will discuss about the medicines being dispensed here in a remote area clinic. Before we go to the actual medicines, let me reiterate and clarify the different types of clinics first in remote area setting, because medicine counts and stocks depends on which category or level of clinic do you have in your site. For me, this is an offshore clinic, so this is a clinic where medicines is not that high in stocks, unlike the other clinics which are on shore. Particularly, my clinic or the offshore clinic belongs to level 6 categories, so it has a lesser stock of medicine compared to the other level types of clinic, which are level 1, level 2, and level 3. When you say level 1, here in Johns Hopkins, we only have one level 1 here in Eastern region, which is the Tanajib Clinic. So Tanajib Clinic is a big clinic actually. In terms of facility, it has an emergency room, lab or laboratory, x-ray, pharmacy, ambulance services, and physician and nurse as the staff. So Tanajib Clinic has a big supply of medicine because it caters a big population in the eastern region. So there is a pharmacy and a pharmacist which or who is working on the medication or medicine stock there. When you say level 2, it differs from level 1 because level 2 clinics doesn't have pharmacy and pharmacist, unlike the level 1 which is in Tanajib. So level 2, they have their own physician also, and nurses, x-ray, laboratory, and ambulance services. And when you say level 3 clinics are onshore clinics where there are only nurses and paramedics working in that site. Let me add, there are also paramedic in level 2 and level 1 clinic. So level 3 clinic, they have their own stock of medicine also, which is higher than the level 6, which is here. Level 6 is offshore clinics. So the difference between level 3 and level 6, even though there are nurses, or it's only a nurse operated clinic, the medicine stock of level 6 is lesser than level 3 because here in offshore we only cater few patients. For example, here in my site, in my platform, the population here is around 100, below 100, something like that. And not all these 100 people are working at the same time. For example, morning shift, maybe around 60 below are just working, and night shift, another 40 or less working. So that's the difference between the level 3 and level 6 clinic. So now we go to the medicine stock that I usually dispense here in my clinic. Check it out. This is the setup of my clinic here in offshore. So you can see here my desk, my computer, and you can see multiple of shelves here, cabinets, where it contains all the medicines and supplies for my clinic. You can see a fridge here. In this fridge, it contains medicine also. So you can see insulins, tetanus, and suppositories. Okay, so when you open the fridge, you will see this. These are the medicine, the fridged medicines. So it stays here, and the temperature is maintained at 32 degrees less. Then we go now to unfridged medicines here in my stock. These are the over-the-counter medicines that I usually dispense without a doctor's prescription. So my paracetamols, strepsils, aspirin for emergency cases. These are muscle relaxant for the back, Paraffin, or the chlorroxazone with paracetamol. I have here also, as you notice, I keep this in the back of this box, the Fibadol, because this is mostly abused medicine by Saudis, because this is a strong pain reliever. But I keep this so they will not see. It should be only given to severe cases of pain. And I have here ibuprofen. This is a telephone order medicine. You need the doctor's advice and prescription also before you give this. These are the strepsils for sore throat, paracetamol. I have here Emidol and Adol. Same formulation but different brand names only. And my aspirin for my Mona protocol. I have here on the top lip balm and petroleum jelly. This is the petroleum jelly. I have Vaseline, the most sought skin remedy here in Saudi, and lip balm for chapped lips. So these are the over-the-counter medicine except for the Sapofin and Fibadol extra. Let's go to the second shelf. These are the telephone orders or medicine that needs a doctor's prescription. Antibiotics. What I have here, azithromycin also, different brand. I have here Cefaclor or Forticef antibiotic, and ample amounts of amoxicillin. These are medicine that needs prescription. Also, I have here antiemetics, Permosan, metoclopramide. I have here paracetamol infusion, 1000 milligrams. Pantoprazole, 40 milligrams. Hydrocortisone, 100 milligrams. IV, these are all IV formulation. Phenytoin, furosemide, and hyoscine butyl bromide. I have here also metoclopramide tablet. On the top, there are creams, topical medicines. This is for pain reliever, the Repaderm gel, Rectacure for hemorrhoids. These are fusidic acid cream or fusiderms, Balad, Betaderm steroid, anti-inflammatory, betamethasone, and for fungal infection, Dermatin. These are the basic topical creams here in Offshore. That one is the what they call this, dermococcal lotion for pruritus, anti-pruritic lotion, and silver nitrite applicators, and my KY jelly. These are rarely used, this KY jelly and silver nitrite. So going to the third shelf, this is the emergency medicine or emergency drugs, where you can see pain relievers here, cefuroxime, lornoxicam or Cefo, anti-allergies like chlorpheniramine or min maleate or Alerfine. In Saudi Arabia, this is the common Alerfine. Promethazine hydrochloride, glucagon injection for hypoglycemia. I have here also acetylcysteine for overdosed paracetamol, and also for secretions, lung secretions. I have here atropine sulfate for bradycardia, amiodarone, cordarone. I have here adenosine for SVTs, epinephrine ampules, and Abujex epinephrine. I have here also dextrose 50% vials, lidocaine, and another lidocaine 1%, 2%. This is Abujex. As you can notice, there is these high alert tags to avoid confusion. Like there, amiodarone, lidocaine. These are high alert tags, so there will be no confusion on medicines. I have here also Imodium. These are the gastric medication, Moxal syrup, antacids, Imodium for diarrhea. I have here antacid tablets, Neospasm or tablet form of hyoscine butyl bromide, Dulcolax here for constipation, and oral rehydration salt or ORS. These are the medicine or emergency medicine and gastric medicine. And the last supply here, another over-the-counter medicines for colds, cough, and drops for eyes and ears. Here on the top, there's Exilin syrup or diphenhydramine syrup, and dextromethorphan syrup for cough, dry cough, and cough with phlegm. I have here also ipratropium bromide for asthma, and Ventolin inhalers and solutions here. On the lower shelf, I have here eye drops, Apisal eye drops for eyes and nose combined, Optizolin eye drops for red eyes or itching eyes, sore eyes, something like that. Dizinil tablet here for dizziness, Juwax for earwax, Ciprocin sterile eye or ear drops if there is bacterial conjunctivitis and otitis media, Gentamicin also, antibiotic cream for the eye, another high alert tag to avoid confusion. These are the look-alike, sound-alike medication tag or LASA tag. I have here cetirizine for allergies. I have here Certazine 10 milligrams. These are the common medicine I give for allergies like nasal allergies and itching. Here, Optifusin eye drops. The most wonderful drug or most sought drug here in Saudi also, Renofed for flu, colds, flu, allergies, something like that, regarding upper respiratory. These are the most sought tablet. Binox eye drop. These are some anesthetic eye drop. Salinos nasal drops, and decongestion nasal drop or spray, the silometazoline. Yeah, silometazoline. Yeah. So these are the medicine stock that I have here in level 6 clinic. So it's only few or less stock here. And these are the items here in my clinic: emergency items, diagnostic items, MRX, suction, oxygen, ECG machine, oxygen mask paraphernalia, IV cannulas, and the like. I learned a lot in my video where I toured you and show you the medical or medicine stock in level 6 facility or the offshore clinics. For those who want to take the risk and take the chance of working here in a remote area clinic, these are the things you need to know for you to be able to work properly in a remote area clinic. Again, this is Kimmerman from Kimmerman Studio saying goodbye, God bless, and happy working in a remote area clinic. Bye-bye.